Hi, my name is Sarah O'Leary. My ID number is 3007441. This is our AVMA task video for Clinical Pathology 2. Alright, now we're going to be performing our maintenance on our Catalyst 1 machine here. This is our chemistry analyzer for our clinic. So we use the vet lab station here to kind of run our Catalyst and our Pro site, but I've chosen to do the maintenance on the Catalyst. So to get started, you go to Instruments, and then Catalyst 1, and then there's going to be the little maintenance button right here. So we're going to click that one, and the first thing they recommend doing is cleaning of the machine. So we're going to hit clean. And it's going to tell us to gather all of the needed supplies. What we need for this clean are the alcohol prep pads and the optical tissues and gloves. So we hit next on that, and then it tells us to open our side door here. Okay, and we're going to remove the carousel. So to remove the carousel, you're going to push this little green arrow, and this little door will kind of lock. It says remove the carousel. So now we're going to remove it. And it says to do the alcohol prep pad first. And what we're going to do is go around the area we just opened underneath the carousel. So there's a little sensor in here that reads the slides. So we're going to go all the way around this with the alcohol. All right, and then we're going to do the same thing for this one. We just kind of go around our little carousel here, and you wipe that little white pad off with it. All right, and then we're going to use our optical tissue to dry this now. All right, and we're going to do the same thing for the inner part of the carousel. And we're going to now replace our carousel. Machines are super smart. All right, and that is how we clean our Catalyst. All right, now we're going to be running our quality control on our Catalyst here. So to get back there, you're going to go to your instruments again, select your Catalyst 1, maintenance, quality control, and on here you're going to select your appropriate lot number and expiration date. All right, we're going to hit run QC. So to get this in our machine now, we're going to open our sample drawer, put our little cup in, and then you use the provided pipette and tips that they supply from IDEX. This one requires 300 microliters of this solution. So we're going to dip this in our solution, and in one smooth motion you're going to press down on the top, and then it'll pull up exactly what you need. You put it in your specimen container cup here. All right, and then it's telling us to go ahead and load our slides in. So we're going to load our QC clip. And then it says to close the sample drawer and press start. So we're going to close that and press start. So that is running quality control. We're going to perform our ELISA heartworm test. We're going to be using IDEX's snap test here. So first off, I put 4 drops of my conjugate in my tube here. And then to my tube, I'm going to add 3 drops, 1, 2, 3, of my blood sample from my patient. Cap everything. And I'm going to gently invert this a few times, and then I'm going to just gently tap it on the table to get it off of the top of the cap. And then what I'm going to do is I'm going to pour my sample into the well here. I'm going to wait for my blood to reach my indicator dot here. So pour your sample in. All right, it is taking Okay, now you can kind of see it show up here in my dots. So I'm going to go ahead and be sure and snap it all the way down. And then I start a timer for 10 minutes. This test will run, and on this test it will have 2 dots. One is the control dot and one is the actual heartworm positive dot. So you should always have the control dot. It should always be present. But if that dot is not present, you need to rerun your test. Your test did not run correctly. So that is how we run our heartworm test. Now I'm going to show you how, what the 4 most common fecal evaluation techniques are. The first one is going to be the fecal flotation. So in my cup here, I've got my 2 grams of feces, and I'm just going to add enough of my fecal sol here. We use just the standard fecal sol. You can buy it from any manufacturer. Some clinics actually make their own. We just buy a pre-made one. And I'm going to fill my cup kind of halfway with this. And I'm going to take my tongue depressor and I'm going to break up as much of the stool as I possibly can. And so I'm going to pour my fecal sample in my strainer. Okay. And I'm going to fill this until there is a meniscus on my tube. Take a slide or a cover slip and I will place it over my meniscus gently. Alright, our fecal test has now sat for 15 minutes, our flotation, so I'm going to gently take my cover slip off of my tube here, put it on my slide, and then I'm going to go right here to our microscope. So on the microscope here, we're going to start on the 10 objective. I'm going to just look at this entire slide until I have read the whole thing. Alright, now I have scanned my entire slide here and I have found no evidence of intestinal parasites on this patient. Now we are going to set up our fecal flotation with centrifugation. So again, here I have 2 grams of my feces. I am going to add my fecal sol. Alright, so I'm going to mix this up with my little stick here. Kind of break up the stool. I'm going to pour it into my strainer. Strain this all off. Again, fill this until I have a meniscus. This one. I will take my cover slip and I'm going to cover my tube. And then I will gently place this in my centrifuge. The important part of all of these diagnostic tests is to properly label your running test. So we use kind of a grid for this, so we know what patient is being run under what number here in our centrifuge or on our little rack here. So we will close our centrifuge here. This is going to run for 5 minutes at 1300 RPMs. And we'll go ahead and hit run on this. This will do its thing for 5 minutes. After this is done spinning, we will then transfer our sample to our rack here, where it will sit for another 10 minutes. Alright, so our centrifugation part of it has stopped. So now we will open our centrifuge. I'm going to gently grab my samples out of here as to not disturb my slide, my cover slip. Alright, now this has sat for 10 minutes, so now I'm going to take my cover slip and put it on my slide. So again, I'm going to start under my 10 objective. You can definitely move into your 40 objective just to zoom in for things like coccidia, protozoans like that. So, glasses. Alright, and I have reviewed this whole slide and found that my patient does not have any evidence of parasites. Alright, now I'm going to set up my direct smear for my fecal. So I've got a slide here in my hand. I'm going to put a couple of drops. This is just normal saline in here. Some people do use the fecal sol, but saline is fine as well. And then I'm going to take some of my feces here on my stick. Okay, and you want it thin enough that you can actually read through it. So now with that, I'm going to place a cover slip over my slide here, and then I'm going to look at it under the microscope again. Alright, so again I'm going to start on the 10 objective, and I'm going to kind of make my way around. Alright, and I have looked at this entire slide and for my direct smear, and I have found my patient has no evidence of intestinal parasites. Now we're going to set up our fecal sedimentation. So for this one I have 2 grams of my feces in a cup here with a tongue depressor, and I'm going to use tap water here. Just going to fill it till it covers everything. And again, I'm going to gently break up everything, not to make a mess. Okay. And then I'm going to take this and I'm going to strain it through my strainer here. Okay, and I'm going to pour this into my test tubes to put in my centrifuge till I have a meniscus again. Actually, you don't have to on this test, you don't have to make a meniscus. But to keep our centrifuge clean, we are going to put cover slips on these. And I'm going to put these in my centrifuge, making sure to use opposite sides of the centrifuge, obviously. Going to close my lid. This is going to again spin for 5 minutes, so I'll go ahead and start this and then wait 5 minutes. Alright, now this has spun down for 5 minutes, so we're going to remove this from our centrifuge. Okay, and you can see our little bit of sedimentation down there. So now what I'm going to do is I'm going to pour this off so I can reach my sediment down there. Okay, then you can see my sediment at the end there. I'm going to take my pipette and I'm going to try to pick up a little bit of this sediment. Put this drop on my slide. I'm going to place my cover slip over this sample. I'm going to go to my microscope and examine this sample now. Alright, again, I'm going to start under my 10 objective and kind of get myself focused on my slide. Alright, and I have reviewed this whole slide and found that my patient does not have any evidence of parasites. Alright, now we're going to run our chemistry panel or our serological test on our patient here. So we have collected serum from this patient. This machine, you can either use whole blood that's been put in a heparinized tube or a serum separator. We used a serum separator, spun it down in the centrifuge for 10 minutes and then pulled off the serum here. So to get started here, our patient has been sent over from our program we use here, which is EasyVet. So you're going to select your patient here, you're going to hit run. Then you're going to select which machine you're using here. So we only have the ProCyte and the Catalyst, but we're going to be running the chemistry on the Catalyst. Then you hit run. So you're going to open your sample drawer here. You're going to put the supplies you need, or the pipette, your sample cup, or your serum separator cups. These are provided from IDEX, and you can also use these. You would put whole blood into the top here, and it requires 0.7 mLs in this little cup, so less blood sample to get from your patient instead of collecting serum and having to spin the serum off, or whole blood and then having to spin your serum off. So you have either option. If you use the cup, it just goes right here. Okay, but we're using our little empty cup here. Now we're going to take our sample here, and you're just going to pull it up with your pipette, and then you will place about 3/4, or you will fill about 3/4 of the cup here. There's a little line on here that you're supposed to fill to. as a minimum guideline. So, and then we're going to run a chemistry 10. It's got 10 different values it will give you from this test. So these come in a little handy clip, and you just take a fingernail and pop that clip off, and it's easier for you to hold and not touch the little pads on it. And it has certain grooves that it fits down in, and you just slide it in and then pull away the holder. And then you're going to gently close your sample drawer, and you can hit start on that. And that is running our serological test. All right, now we're going to set up an ear cytology or swab on our cat patient here. This is Darla. She's actually our clinic cat. So you're going to take a cotton swab applicator. I'm going to just gently, you could kind of zoom in here and see, we're going to get some of this debris on the outside of her ear and grab a little bit of the inside. You don't want to go too deep. You want to kind of stay out here on the pinna as to not hit their eardrum. So this is my right ear, so I'm going to put this one on the right side of my slide. Okay, and you want to roll this in a rolling action instead of just rubbing it. That is the proper technique for putting the sample on the slide. Okay, and again, I'm going to now take some sample from the left ear. I'm just going to get kind of out here on the pinna and right there where I can see. Okay, and for this sample, I'm going to put this on the left side of my slide. And so again, I will continue just spreading this on my slide. Once I have this on my sample on my slide, I will take a marker and I will label my slide so I know which patient this sample belongs to. I will take my ear slide here, and I'm going to use a lighter, and I will heat fix this for about 10 seconds. All right. And then to kind of get some of that soot from the lighter off the back of it, I'm going to take with we usually have some chem wipes to use, but I'm going to use a paper towel for the video's sake. Put it back on here. And then for my stains, we have our Diff Quick stains here is what we are using. This first one is kind of it's a fixative, it's an alcohol-based stain. And for this one, I'm going to put my slide in here. I'm going to let this sit for about 15 seconds. Okay, I'm going to tap off any excess. I'm going to put it in my red stain now. Tap off any excess on here. And then I'm going to put it in my purple dye. Again for 15 more seconds. Alright, I will remove my slide and gently tap off any excess. And then I'm going to get a slow stream of running, just tap water is fine to use here. I place it opposite side of my sample and just run some water over it to rinse off the excess stain. Okay, and I will let this sit for just a few minutes in my slide holder and replace all my caps. Ideally, you want this slide to dry. You could use some kind of dryer as long as not a lot of heat is on it. But after my sample is dry, I will look at this under the microscope. All right, now my slide has dried, so I'm going to take my slide and look at it under the microscope here. So you'll put this on the stage of your microscope. And I'm going to focus here under my 50 lens, or my 50 objective. Actually, what I'm going to do is put a drop of my immersion oil now. Be sure to use immersion oil, not mineral oil. Alright, and I will look at this right ear and my left ear sample on here. And what we're looking for on here is any bacteria, yeast, you could have mites even on your ear swab if there's a lot of debris in like kittens or dogs. mostly seen in like kittens, but you could also see mites on your ear cytology as well. So for this ear cytology, my results were for my left ear, my right ear, there was malassezia 1+ per high power field, and there were also evidence of epithelial cells. My left ear had, or was negative. I did not find anything evident on that side. Hi, we're going to be doing our necropsy now on our cat here. Kind of to get ready for this, we have all of our protective gear on. We use gloves, gown, hats, and mask. We also have a formalin jar for our specimens when we collect them. For the sake of the video, we're going to be using one specimen jar and put all of our samples in there so we don't waste our supplies. We also are going to use a blade holder, some scissors, some forceps, and some hemostats. And this is Dr. Dennis, and she's going to be performing our necropsy.
So this is a 7-year-old male-neutered domestic short-haired cat who presented with an acute onset of vomiting, and the cause of death is ultimately unknown. He decompensated very quickly, and we're trying to figure out if we can explain what might have happened. So to begin our necropsy, we'll perform a general external exam. This cat is obviously in very good condition, no wounds, no evidence of trauma, no broken bones. Really looks like it was a previously very healthy cat. After an external exam, we'll move on to an internal exam that will begin with a midline incision into the abdomen and possibly the thorax based on what you are worried about. So we'll begin our approach to the abdomen. Okay, just getting through some fat and muscle right now. So first of all, just a general exam. There is no blood, no fluid in this abdomen. The first thing you can see is the omentum and some intestines. If you start to exteriorize that, you can get visualization of the spleen, kidneys, liver, stomach, gallbladder. Right kidney, the caudal abdomen, the colon, the urinary bladder, which is very, very small. So on kind of a brief exam, there's no obvious gross lesions, no obvious explanation of death, just on a quick internal exam. So at this point, we're going to proceed with collecting some samples from various organs for microscopic evaluation. So I'm going to go ahead and start with the spleen because it's the most accessible. And if there was a lesion or a mass in the spleen, I would definitely want to sample that. The spleen is very uniform, so I can just take a small piece from the tip, from the tail of it. And hand it to my assistant who's going to put it in a formalin jar for me. And we would obviously label this spleen. To save on supplies, we're just going to put everything in one jar, but if we were doing this for diagnostic purposes, we would be putting them in separate jars and labeled separately. So the liver does have a couple of multifocal mottled lesions around it, so I definitely want to make sure I get one of those. Could be a sign of a toxic event, or most certainly want to have that evaluated. And then generally I'm going to take a sample of the kidney. Left kidney is a little easier to access, so I'm going to sample that down here in the abdomen. A wedge incision of the kidney. See the medulla and cortex even. And generally speaking, you would also want to look at the stomach contents, the contents of the GI tract, looking for any kind of gastrointestinal toxins or contents. That's not necessary for these purposes. Because of this cat's history, we would also proceed to evaluate thorax and possibly even the nervous system if we were still looking for cause of death. But this will kind of conclude our evaluation of the abdomen.
All right, thank you, Dr. Dennis. Welcome. All right, now for our rabies testing and our rabies suspects, ideally the only people that should handle those cases are people that are vaccinated for rabies. So generally speaking, that is either a licensed technician or a veterinarian. So the protective gear you need is definitely gloves, some kind of gown to cover your clothing and you, as well as a mask for your face and your mouth. And as far as, you know, how the specimen is shipped, usually to prepare the body, most people for large animals, they will just remove the head of the patient and submit that. If the patient is small, you can definitely submit the whole body. That's not ideal, but they will accept it that way. The specimen is shipped to your state lab or your state veterinarian, and they will, they essentially remove the brain and have that tested. This specimen should be shipped on ice, not frozen, but shipped on ice. And the box or the package should be labeled with a biohazard label. Or some clinics will usually send them off to an outside laboratory that may do all of the shipping for them. As far as the remainder of the body, the rest of the body should be cremated, and that's pretty much your only options for the rabies suspects. All right, now we're going to be collecting our vaginal cytology. This is our patient Sugar here, and Dr. Bay is going to be helping us with this. First, we're going to cleanse around her vulva. Guess I don't need to hold your tail. Just getting off any extra debris or any mucus that may be there. All right. And then I'm going to open my sterile cotton swabs here for Dr. Bay. She's going to insert this. I'm going to moisten her cotton swab as well. Make it more comfortable for the patient. Alright, now that we've obtained our vaginal cytology here, we're going to stain it with our Diff Quick stains. So again, I will dip 10 times 1 second dips. Okay, that's my fixative. And now onto my red dye. Okay, and now for my blue. Alright, I'm going to tap off any excess and get a gentle stream of water here to rinse my slide. I'm going to rinse my slide until the water is clear. All my stain is off of there. Alright, and now we will let this dry and look at it under our microscope. Alright, now we're going to look at our vaginal cytology under the microscope here. So I am under my 20 objective lens here. So I'm going to position myself on my slide and kind of see where I have the best sample on here. And what I am looking for is this female dog stage of estrus. So I will evaluate the cells on my cytology and figure out which stage she's in based on the cells I see. Usually you will you try to do them on, or most of the cytologies are done on in heat females, trying to figure out whether or not they're ready for the male. Breeders will use it, or people just wanting to know kind of where their dog's at in the process if they're looking to breed them. And that's our vaginal cytology. Alright, now we're going to be performing our skin scraping here. This is Mia, she's our little patient, and we found a little hairless area here that we are going to be testing for mites. So for my supplies, I have mineral oil, I have a dull scalpel blade, and a slide. I have already gone ahead and put a drop of my mineral oil on my slide here. So to start this procedure, we will kind of pinch on the skin a little bit, try to raise some, and start. To do this, you scrape horizontally with the skin, and what you're going to do is scrape until you see blood. These mites are deep within the hair follicle, and so you have to get down to the hair follicle to see them on your slide. Good girl. And then you can kind of tap your hair and your crest right here on your slide where your mineral. Alright, we are just now starting to bleed, so I'm going to stop there. She's being a good little patient. And now I will take my slide and look at it under the microscope, and what we're looking for is mites. The two most common are Sarcoptes and Demodex. Now I have my skin scrape slide, and I put it on my microscope stage here, and what I'm going to do is look at it under my 10 objective. If you wanted to necessarily zoom in and see a little closer, you could zoom in to your 20 objective, but I will go ahead and look at this one under my 10. And you can, you don't necessarily have to scan the whole slide, but look at majority of the sample you put on your slide. If you don't find evidence of mites, you may need to repeat your skin scrape, because it may just be a non-diagnostic sample, and then in that case you want to try again. Alright, now we're going to be performing our cross-match agglutination test. So to prepare this test, I have already gone and spun down my 2 serum samples for my donor and my recipient, as well as I have spun down an EDTA tube on both patients. I actually have 2 for both patients since we have such small tubes. So to get started, what I'm going to do is take one of my EDTA tubes here with my plasma in it, and I'm going to take a pipette and decant the supernatant off of this one, and then I'm going to take 2 drops of my blood and put it in here, and I'm going to put in my 9%, and then I'm going to fill my tube with my 9% saline solution to do my first wash, my erythrocyte wash. And put 2 drops. Oh, didn't quite get enough. Alright. And that one is my recipient. So I have that one labeled my wash recipient here. Oh, and I need to add my saline to it. So again, I'm just going to fill my tube here with my saline solution. Okay. And then I'm going to gently invert this and mix it, and I'm going to repeat the same thing for my donor here. So we'll put the Alright. I'm going to take 2 drops of my donor blood and put it in my red top tube here. Close up my tubes. And again, I'm going to fill this one now with my saline. Okay. And then again, I'm going to do the same thing with this patient. So now I have my first wash or I'm going to do my first wash on both my serum and my donor and my recipient. Alright, now I have centrifuged my first wash here. So we centrifuged our 2 samples at 3,400 RPM for 1 minute each. This is my first sample. This is for my recipient, Jim. So what I'm going to do is I'm going to decant my supernatant now. Okay, and again I'm going to do another wash. So got another syringe here with some saline. I'm going to put my saline back in here with my recipient again. Gently inverting, doing my second wash. Okay, we'll do the same thing for sugar here. Alright, do another wash on this one. Again, here's my saline, into my tube. Gently inverting again, getting all the stuff from the bottom here. Alright, we're going to centrifuge this again for 1 minute at 3,400 RPMs again. Alright, now we have centrifuged this again for our second wash, and I just pulled my recipient sample out here. So again, I'm going to pull off the supernatant to do my final wash, hopefully, for this patient. Okay, then I'm going to put my saline back in here. This is a 9% sterile saline solution that we're using. Okay, gently inverting again. Alright, do the same thing again for this one. This is my donor sample. Okay, another saline wash. Gently inverting. Centrifuge this again at 3,400 RPMs for 1 more minute. Alright, now I have spun this down again for my third time, my third wash, and since my supernatant is clear and colorless, I have a successful wash. So now I'm going to go ahead and pull this off again. Just pulling off this supernatant, trying not to get my erythrocytes mixed up. I did kind of mix them a little and try to avoid pulling them up again. May have to re-centrifuge this sample a little bit. Yep. Alright, now I have spun this down again for my third time, my third wash, and since my supernatant is clear and colorless, I have a successful wash. So now I'm going to go ahead and pull this off again. Alright, now I have my washed erythrocyte sample here, and I'm going to create my suspension. So in this left tube here I have my washed erythrocytes, which I'm going to pull 0.02 off of my packed washed erythrocytes. Okay, and I'm going to put that over here in this other tube. Okay, and I'm going to put 0.98 saline in here with this. Okay, that is my recipient's suspension now. I'm going to gently mix this up, put it on my rack, and I'm going to repeat the same process for my donor here. So again, 0.02. That tube, close this one, with my 0.98 saline into my donor tube. Okay, and I will gently invert these, mix it up, and now we will start our major and minor cross-matching test. All right, now we're gonna do our major cross match. So to do this test, what you're gonna do is you're gonna take 2 drops of your recipient serum here. And I'm gonna put it in a new labeled tube. And then I'm gonna take 2 drops of the donor's wash or suspension and put that in there with it. And 2. And now I'm going to set this aside. That is our major cross match. So for our minor, we're going to take 2 drops of the donor serum. Okay, so again, the donor serum. 1, 2. With 2 drops of the recipient's erythrocytes. All right, and now we have set up our major and minor cross matches, and we're going to let these kind of sit here in our rack for just a second, and we'll finish setting up the rest of our agglutination test. All right, to check for auto agglutination, what we're going to do, we have 2 tubes labeled control, one for our donor and one for our recipient. So to begin this, we're going to take 2 drops of our donor's serum, put it in our new tube here, and then 2 drops of the erythrocyte suspension for our donor into this tube. Okay, that's our control. And we're going to repeat this process for the recipient. All right, now we're going to repeat the process for our donor here. So we're going to take 2 drops of our serum, put this in our new labeled tube that says control. Then I'm going to take 2 drops of my recipient's suspension. Okay. All right, so here we have set up our 2 controls for our donor and our recipient, and our major and our minor cross-match test here. So what we're going to do is we're going to gently mix, and then we're going to set them in our rack here, and we're going to leave them untouched for about 30 minutes at room temperature, and then we will centrifuge these for 1 more minute at 3,400 RPMs. All right, so these have spun down for a minute now. So here we have our controls. And what we're going to do is we're going to look at these for hemolysis. So I'm going to gently shake my tubes and see if I can see anything, any agglutination happening here. I don't see anything to the naked eye here. I'm going to do the same thing for my major and my minor cross match here. Looks like my major is not resuspending, so we will look at these under the microscope and see what's going on. I don't see, there may be some agglutination here on my major cross match though. Alright, so I have my slide here set up on my microscope stage. I've lowered my condenser. And I'm looking at this under my 20 objective. So what I'm essentially looking for is for clusters of my erythrocytes. If they're in clusters, this means that you do have agglutination and these are not a match. This donor and the recipient are not a good match with each other. And unfortunately, we have that situation now. There is definitely agglutination in both of my samples, or in my major cross match, so this would not be an ideal donor for this recipient. So